Yeah, sure. So just a little bit of the background. Colorectal cancer is the third most common cancer in the US. And we as a company are committed to fight this disease. And one of the area where a lot can be done is improving performance during colonoscopy. So GI Genius is the result of years of work with a company which is based actually in Italy called Cosma Pharmaceutical, a leader in pharma and drug into the GI. This company developed this artificial intelligence technology using 13,000 different videos to build the algorithms into the device. So the device is very accurate. It's 99.6% sensitive, which means anytime on the screen during the colonoscopy, there is a lesion, a green box is going to pop up and it's going to grab the attention of the endoscopist to focus on this area, and eventually the GI, the endoscopy, is going to make a decision whether or not this is a lesion that needs to be removed. So great question. We actually have seen many different publications already, but there is one which is very, very important. It's actually first level of evidence, randomized controlled trial. It's a study that has been performed in Italy by Professor Repici. And the study showed that with the use of GI Genius during normal endoscopy, colonoscopy procedure versus standard colonoscopy without GI Genius, there is an improvement of 14.4% in detection rate. So the baseline of these endoscopies was already pretty high, expert endoscopists, but this shows that the technology can also help those endoscopists who are skilled in performing colonoscopy even further. I mean, this is a very important piece because we really as a company believe that we have to improve a patient outcome with our technology. And this level 1 evidence is giving this actually very strong reassurance to our customers that this device is working and is working very well. I keep saying not every polyp, not every adenoma become cancer, but every cancer used to be an adenoma or a polyp. So that gives you the feeling that if you miss a polyp, if you miss an adenoma during the procedure, for many different reasons, hard to see, fatigue, very challenging procedure because of the anatomy of the patient. There are many reasons, right? So, and if you miss it, what happened before you go for the follow-up, usually it's 5 or 10 years for the follow-up colonoscopy, cancer can be developed, and it's called interval cancer. So imagine this, you as a patient go for a colonoscopy, you get your answer, it's negative, and 2 or 3 years after, you have to deal with colon cancer. So most likely this could be because a polyp, an adenoma, was missed during the colonoscopy before. So that's the reason why it's very important. This disease is preventable. So if caught early, 90% of the patient will beat it. And that's the reason why this technology is truly going to make a big improvement on performance and also detection rate for our customers across the country. We as a company, as a Medtronic, we keep saying, and really we believe that we need to put the tech back into the med tech, which means technology like artificial intelligence. They already are playing a very important role in many different areas. I think about radiology, breast cancer detection. All of these procedures, they've been already automated over the last 5-7 years. Now, GI, it's at the early stage of AI, but I can see the future is going to be like, there will be no colonoscopy performed without AI-assisted technology. There will be additional features and procedures which can be also assisted by artificial intelligence. At the end of the day, the doctor is going to make the final decision, right? So we are not overcoming this. We'll never do that. But we're going to support decision making with our technology. Almost like, I keep saying, having an angel on your shoulder that doesn't blink and is going to be there when you maybe can be tired, or maybe there is some distraction in the endoscopy suite, and for any reason you can miss a potential lesion. So I think AI is going to help. AI is going to evolve also in medtech, and more to come, because investment also for Medtronic as well. We're investing over $2 billion across the businesses to really bring these technologies in different areas of the specialties in medical device. It's super exciting for all of us. We are committed. We really want to support our customers across the country. We believe that this technology can help improving performance and also improving patient outcome. So thank you very much for the time and the opportunity to talk about this.